One of the biggest and most exciting trends in plastic surgery today is fat grafting. Fat from your own body, called autologous fat, can be used in the face to improve or rejuvenate the face, make your breasts larger for natural breast augmentation, lift your butt by Brazilian butt lift, and even use in the fingers and hands to rejuvenate your hands. A lot of research today is focusing on the best technique for fat grafting. I presented a paper at the American Academy of Cosmetic Surgery that compared 3 techniques: standard suction or Coleman fat grafting technique, 2 water jet assisted or body jet technique, and ultrasound or the VASER technique. What I presented, the results showed that overall VASER liposuction fat and water jet assisted fat yield the best results. However, body jet liposuction does not provide the optimal body contouring result. So using VASER fat provides both excellent body contouring with a smooth result, maximum fat removal, and skin tightening. However, we also have the fat from the VASER that is not injured and can be used for fat grafting. The technique of VASER fat removal uses ultrasound, which separates fat cells from blood vessels. It also separates stem cells from other tissues as well. So when we're harvesting the fat has approximately 2.5% stem cells. These fat cells and stem cells can be implanted in different anatomical areas and survive. We also added a new technology called Pure Graft. It's made by Satori. It's a way of what we call lipodialysis. That means we're removing free-floating fat, we're removing dead cell membranes and blood to maximize the concentration of adipose cells, adipocytes, fat cells, whatever term you want to use, and stem cells. That optimizes our final outcome of fat survival. So if you need volume, instead of using dermal fillers, such as Juvederm and Radius in the face, instead of using silicone or saline breast implants, you can use your own fat, which is very safe because it's coming from your own body. So I prefer VASER liposuction technique to remove the fat, Pure Graft lipodialysis to purify the fat, and then with the technique that I train physicians and surgeons in the United States for fat administration in several layers to maximize vascularization to the fat with optimal results.
My friend just had a procedure with Dr. Troell, and he was very pleased with the results, so that was my main reason for choosing him. The procedure were facial fat grafting, VASER liposuction of my abdominal, inner and outer thigh, upper back, and my hips area. Dr. Troell recommended to me a VASER liposuction because he said I was the best candidate for this kind of procedure. I would get the most results and would be minimal bruising. The skin would be much more tighter and he could remove the most fat. So that was the reason why I made the decision on choosing this procedure. And also I did research on my own, and it also shown that it was the procedure with the least complications. I was very happy and pleased with the outcome of the surgery. It wasn't as painful as I thought. The bruising was minimal. The recovery time was only a few days. I was able to return to work very quickly, and I have changed in sizes. I went from size 6 to size 2, which made me very happy. I'm much more comfortable and just feel great.